Dr. Nitish Bharara is a regenerative medicine specialist at BSI, and every day he is helping patients dealing with terrible back, neck, and body pain. When surgery isn't the right answer, or when it's not possible, often regenerative medicine treatments like stem cell therapy or platelet-rich plasma come into play. Before he was a doctor, Dr. Bharara was a patient, and he needed knee surgery. And he says if he knew then what he knows now, he probably would never have undergone the procedure. So when we first heard him say that, we were intrigued and we thought you would be too. So let's talk about it. Dr. Bharara, thanks for joining us.
Thanks for having me.
Okay, so let's start with take us back in time. What kind of injury led up to you needing surgery in the first place?
Yeah, so when I was 16 years old, I was an avid soccer player, loved playing soccer. And unfortunately, I got slide tackled on the field, broke my leg, and unfortunately also tore my meniscus at the same time. Um, Had a cast for a while. Unfortunately, luckily didn't need surgery for my fracture. But after my fracture healed, I was still having a tremendous amount of knee pain. And so had an MRI of my knee. Unfortunately, I did have a meniscal tear. And at that point, saw an orthopedic surgeon. And that's when I got the news that surgery was my only option at this point. I needed to move forward with it sooner than later.
So there were no. One of my questions was going to be what options were presented to you. The answer is just one.
Well, really, at that point in time, yeah, there was no other options. He basically said, let's go ahead and get this scheduled. You've had you still have knee pain. Knee pain's not going away. There really isn't any other options to move forward with. Let's go ahead and get this started.
And did you, you're 16, were your parents driving the bus at that point, or were you? And did you ask a lot of questions, or it was just sort of, here's what we got to do?
I think when you go and see a doctor, especially my parents, even though they're not in the medical field, but they're both scientists, and so they ask questions in terms of recovery and that sort of thing. But I don't think we asked enough questions to understand what all the options were at the time. And I'm not sure the doctor really presented any other options for us. The options at that time was, hey, listen, surgery is the only answer for you. So I never fault my parents for not asking more questions. And I'm not sure they would have gotten a different answer for it. But I do think at that time, the only option that was presented was surgery.
Yeah, definitely. I'm definitely not faulting them either. And quite frankly, I talk to so many patients. People are still told this. I mean, this is not just a story from the past. It's amazing to me how often patients today are told, hey, look, the only thing we can do is surgery. But before we get to other patients, finish your story.
Yeah.
So what was surgery like?
Well, surgery was terrible. It was honestly a really challenging surgery. They did a partial meniscectomy, meaning they just took part of the meniscus out. Recovered from surgery after about 4 months. Pretty painful recovery initially, but then got easier. Unfortunately, never got better.
Wait, you went through all of that and it didn't fix the problem?
Unfortunately, didn't fix the problem. Went back to the surgeon, who then referred me to another surgeon, who told me that I needed surgery again. Had another knee surgery.
How old were you when you got the second one?
I was 17 at the time. So a year later, had another knee surgery. Unfortunately, didn't get better again, and ended up having a third knee surgery later on that year, right before I turned 18. And then at that point, it was a larger meniscectomy. It took out most of my meniscus, and then I needed something called the lateral release at that time as well. Made a little bit of a difference. Never got back to where I was. And actually, subsequent to that, fortunately after that, years went by. I did a lot of physical therapy, and then I got introduced to the regenerative medicine world, and had PRP injected in my knee and along my meniscus, and which is actually made one of the bigger differences for me,
because it regenerated healing.
Right. So, it stimulated the healing process. And I think at the time when you do surgery, we know the repercussions of surgery. We knew it a little bit back then, and we definitely know it now. One of the issues that whenever they scope your knee, even though it's a easy they say an easy surgery, and in comparison to other orthopedic surgeries, it is. Um, we know that there are repercussions to doing it, and one of the biggest repercussions is osteoarthritis that develops in your knee. And so, one of the issues that I've had with 3 scopes is that I've developed some osteoarthritis in the knee. And so, what PRP has helped me do is deal with that osteoarthritis, and as well as deal with some instability of the knee. When you take a piece of meniscus out, it adds and it creates an unstable knee. And so PRP has made a really big difference for that, as well as helping with my meniscus. So it's made a big difference in my life. And you go back and think about whether I would have done it again. 2 years in my life were gone for some knee pain, and I'm not sure that's not the only. At that point, it was the only decision that was presented to me, or only option that was presented to me, but maybe not the best decision.
Okay, I have many questions.
Sure.
Look, sometimes surgery is the right thing for people. As you look back now as a doctor, what was happening? Was surgery the wrong thing to do because it couldn't fix the problem at all? Was this just the way that your injury was, and so that's why it didn't work? Was
Yeah.
Which one do you think it was?
Well, we're lucky at this point in life. We have lots of options in treating orthopedic conditions that weren't necessarily available at that time. I think at that point in time, what we knew about the condition of the meniscal surgeries, there wasn't a lot of options. And I also think it's a belief by different practitioners that maybe surgery is the right way to go and do it quickly. I wish I had spent more time in physical therapy at that time. And so going back and looking at my MRI, and knowing what I know now, and the experiences that have led me up to this place in my life, I wouldn't have done it, and I would have attempted a lot of other non-operative options first, because when you go the surgical route, there's no going back, and unfortunately, if it doesn't work, you're leading up to this repetitive surgical process. And in certain situations, it's the only decision, and it's the right call. I go back and look at my own self, and knowing what's happened to this point, I'm not sure I would have done it. And I think if we had the options that we have now, I don't think it's even it's not even really something that I would recommend is going through surgery. I recommend treating all the non-operative options, because usually that's actually what treats it. We've had a lot of data and a lot of research that's actually shown that meniscal surgeries don't have a better outcome than treating it non-surgically. And so we now have a lot more information to say that we shouldn't have done it. But at that point in time, it was the decision that was made.
So what I think is so interesting with your story is, I know I interview a lot of patients. I mean, you meet and treat a lot of patients, and people are still having this experience all the time, right? Where they go to the doctor, whether it's for the knee or for something else, and another doctor says, it's time for surgery. That's the only thing you can do. So people are still being told this all the time, right? That surgery is the only option. So walk us through the steps. If you could go back in time, or if it were to happen now to your child or to you, let's say it's the same exact injury. Walk me through what you would do. What are the questions that you would ask? What are the different things that you would explore
Absolutely.
before surgery?
Yeah, well, number one, when you have any injury to your body, or any pain symptoms, especially musculoskeletal, the number one thing that you want to make sure of is you want to make sure of the diagnosis, right? So when many people will go and see an orthopedic surgeon, and when you see an orthopedic surgeon, there really is the option of surgery, or you don't need surgery. There really isn't. All that middle ground of being treated really doesn't exist in that world. And that's not saying anything bad about orthopedic surgeons at all. It's just that their training is usually surgery or non-surgery, and if you're in the middle there, you're probably not the best candidate to see one of them. And so one of the things that you should definitely ask, especially even when surgery is offered or when it's not offered, is what are all the options that are available. And depending on how much time the surgeon has with you, as well as kind of their knowledge base and their training, they'll may be able to give you a very educated response, or they'll potentially refer you over to another doctor. I always think it's great and important that a patient get both two views on every situation, right? There's a surgical view and the non-surgical view. And sometimes that non-surgical view is you need surgery. And sometimes that surgical view is you don't need surgery. You need the non-operative options. And so I think it's always nice to have all the options presented to you, because that will let you make an educated decision on what the next step is. So I really think talking to your practitioners, getting multiple opinions, looking at the data that's out there is really helpful for the patient to make the best educated decision.
That's super helpful. So right, you want to ask both a surgical and a non-surgical expert what are all the options. Do you, I'm going to put you on the spot here. Do you ever have someone who comes to you, you go through a ton of regenerative medicine, non-operative things, and eventually say, look, I think we've tried everything. I do think you need surgery now. Do you end up doing that sometimes?
Absolutely. I mean, we have to remember something. Regenerative medicine is a great option and helps a lot of people. But there are times when regenerative medicine maybe isn't the best option, or regenerative medicine isn't even an option. In those situations, surgical intervention is absolutely necessary. One thing that we know about regenerative medicine is that it will it there's always the surgical option afterwards. But if you do the surgical option, the regenerative medicine isn't an option. So, when we're treating musculoskeletal conditions, there's always a paradigm, right? You always try to treat with the least invasive option first, and then you gradually go a little more invasive depending on how the outcomes are. And so, there are times when you don't want to start the least invasive option because it's no chance of it working. And in those situations, you move over and directly go to the invasive option, which is the right decision. And that's why I think it's really important that you see both sides of it. The non-operative physician that will maybe treat you regeneratively or with therapy or with other types of procedures, and the surgical option, because if they're working together in this situation, you're going to have the best outcome. It always works that way.
Okay, so that's in the best case scenario. I'm going to ask you kind of a tough question here, but I know this is something patients run into a lot. Sometimes you get such disparate suggestions and treatment options presented to you that it's confusing and it's hard to figure out which one do I do. Also, what I hear from patients that they get told a lot by surgical experts is, look, anecdotally you'll hear that regenerative medicine works, but there's no data to back it up. We don't have the proof. So what do you say to patients if they're told that?
Well, I think a lot of I hear it all the time, especially when patients come and see me. They say, well, I talked to my orthopedic surgeon, and they said there's no data in using stem cell or PRP or bone marrow or fat to treat this condition. And the truth of it all is that is absolutely wrong. We have data now, and data that's shown that operative versus non-operative regenerative medicine options, the regenerative medicine options are better in certain situations. So I think the field is moving quickly. It's moving very quickly, and so not everybody knows all the data that's out there. And I think that's why it's really important to see both sides of it, right? As a non-operative doc, I am not clear on all the operative data, and I'm not going to tell you I do, and that's why I want you to see a surgeon and have their opinion. But I can tell you that I'm very knowledgeable, and I'm in a good place where I can actually do a lot of the research and help publish in our field. And so with that information, I know the data for non-surgical regenerative options. And so I think patients hear this, but not everybody is completely knowledgeable about what they're saying. We see a lot of great outcomes with the regenerative medicine, but I see patients that come to me that ask to do regenerative medicine, and I tell them, unfortunately, this is not an option right now. We need something else. And so, that's why you need to see somebody that knows kind of all of the options that are available, and with experience to know what works and what doesn't work.
All right, let's wrap it up with your personal story then, because I think those personal examples, the success stories, are also really important to hear. You were saying that you did PRP on your knee.
I did.
Were there any side effects or problems from doing it? How often have you done it? And how's your knee now?
Yeah, so I've injected my knee 3 times. First time I did it to myself. It's a little bit of a challenging procedure to do on yourself because just positioning is a little bit of a challenge. But it worked, and I saw some benefit. And then subsequent times, 2 other times, I had another practitioner do it to my knee. We did it under ultrasound guidance, so it was very particular in terms of what we injected and how we injected. Um, and honestly, I've seen great outcomes. I've been able to play basketball again. I've been able to get back on the field and run again and play soccer without my knee blowing up and having a tremendous amount of swelling. So it's
Does
worked
it
for me.
look different if you do an MRI of it? Or does it look different, or is it just about how it feels?
Well, it depends on what you're treating, right? And so if you're treating a acute meniscal tear, on MRI you can see a change on the MRI. If you're treating osteoarthritis of a knee joint, you may not notice a change in the knee itself, even though the knee no longer swells and you can run more and it's no longer painful. And when there is discomfort there, it's short lived. That's what you're looking for when it comes to osteoarthritis. So it depends on what you're trying to treat. In my situation, I was trying to treat instability, a meniscal tear, and osteoarthritis. And so I haven't done the MRI afterwards because in my eyes, what I want to be able to be more functional. I want to be able to play with my kids. I want to be able to enjoy my life and go play sports and get healthier. That's what I want. And so as long as I'm maintaining that and I'm able to do what I want to do, the MRI wasn't important to me. But you can see MRI changes depending on what you're treating.
Oh, so interesting, Dr. Bharara. Thank you for walking us through this. And yeah, ask questions, get a second opinion, and make sure you're exploring all
All the
options.
options.
That's the bottom line, right?
Absolutely. That's exactly right.
Thank you so much.
Thank you.